At Security Health Plan, we're celebrating you. And you. 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 And you. By offering affordable Medicare plans with special perks just for you. Because we all want a Medicare plan that puts you first.
Hey, Jim.
Hey, Mike. What's up?
The car looks great. Nice work.
You want to help?
Oh, no. That wouldn't be a good idea. I just stopped by while Mary went for a walk.
Yeah, she called and asked Ellie to walk with her at the park.
Anyway, I saw this ad on TV and it got me to thinking. You know, we're getting to be that age. We got to start thinking about Medicare.
I know. How did that happen? Do you know anything about Medicare?
A little, but I certainly don't know enough about it at this point.
Agreed. I do think it's a good idea to choose a Medicare plan. And I have a friend who has a plan from Security Health Plan. He's very happy with his plan, and he loves that they're a local company.
Yeah.
Are you ready for Medicare? Talk about a tricky subject. Hi, I'm Brian Kelly for Security Health Plan. Over the next half hour, I'll help you gain a better understanding of Medicare in general. I'll talk about Security Health Plan's options for Medicare coverage, including Medicare Advantage, Medicare Supplement, and Medicare Medical Savings Account plans. Before we get to that, I bet some of you are wondering, what is Security Health Plan?
Security Health Plan is a not-for-profit insurance company that has been based in Marshfield for 50 years. But more than insurance, Security Health Plan has been a leader in supporting health for our members and communities. A recent example is the COVID-19 Community Support Fund, established jointly with the Marshfield Clinic Health System's Center for Community Health Advancement. We were the first health system in Wisconsin to establish a fund that provides financial resources to community organizations affected by the pandemic. Now, on to Medicare.
Now, this may be the first time you can enroll in a Medicare plan, or you might be thinking about switching your plan. But what is the right choice for your lifestyle and budget? Well, that's what I'm here to help you understand. I think you'll find that Security Health Plan has a Medicare plan that's right for you. Let's start by covering some Medicare basics.
Now, you said that your friend says that Security Health Plan really knows their stuff. Well, that's good, because I really don't know that much about Medicare.
Here's what I know. Medicare Part A is for when you go to the hospital, and Part B is for when you go to see the doctor. Parts A and B are known as Original Medicare. That's about it.
When you only have Original Medicare Parts A and B, you are responsible for the remainder of the costs for all these services, including large deductibles and coinsurance. And you should note that Medicare has no limits for how much you'll have to pay out of pocket in a year. This is where Medicare Supplement plans come into play. You still have Original Medicare Parts A and B, but the Supplement plan helps pay for the deductibles, co-payments, and coinsurance. Security Health Plan offers a supplement plan that can be a valuable option for protecting you against additional costs. There are also two more parts to Medicare, Part C and D. Medicare Part C is commonly known as Medicare Advantage. Medicare Advantage plans replace Original Medicare by covering Part A and Part B services. Your coverage and claims are handled by contracted third parties, like Security Health Plan. Medicare Advantage plans simplify your life by combining all Medicare coverage under one plan. Finally, Medicare Part D is Medicare's prescription drug coverage.
There are multiple ways to receive Part D coverage. You can have a standalone Part D drug plan or a plan such as Wisconsin Senior Care to match with a Medicare Supplement or Medical Savings Account plan. We'll go over all of this a little later.
At Security Health Plan, we're celebrating you. And you. 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 And you. By offering affordable Medicare plans with special perks just for you. Because we all want a Medicare plan that puts you first.
Medicare Parts A, B, and D help cover your costs for hospital stays, doctor visits, and prescription drugs. Straightforward, understandable. But Part C, Medicare Advantage, is quite a bit different. I'm thinking you might want to know more about Medicare Advantage.
I wonder when we have to sign up for Medicare. We're not really ready for all of this. Mike said he doesn't even want to think about this until after we turn 65.
I don't think you should procrastinate. My friend said there are several options when to enroll, but it's good to get started as soon as you can.
The first option is called your initial enrollment period. This is when you first become eligible for Medicare.
You have 3 months prior to and 3 months after your eligibility month to join a Medicare plan. For most people, your eligibility month is the month you turn 65. For example, if you turn 65 on April 14th, you can enroll in any of the 3 months prior to April, January, February, or March, during your birthday month of April, or during any of the 3 months following April, May, June, or July. In short, you have a 7-month window to enroll when you're enrolling in Medicare for the first time. Option 2. Each year after your initial enrollment, you'll have an annual enrollment period, or AEP. During this time, you can make changes to your Medicare Advantage coverage, add or drop coverage, or switch plans. This annual enrollment period runs from October 15th through December 7th. Finally, a special enrollment period, or SEP. As the name implies, SEPs arise under special circumstances, such as moving out of your plan's service area, moving into or out of a long-term care facility, becoming fully eligible for dual benefits in both Medicare and Medicaid, leaving a group health plan offered through an employer or union, getting extra help paying for Medicare prescription drug coverage, or losing your current creditable drug coverage.
Now that we know when you can enroll in a Medicare Advantage plan, let's talk about the Medicare plans available in your area. Before we look at plan specifics, I should mention that Security Health Plan's Medicare plans are available only to residents of Wisconsin.
Okay, so there are plenty of chances to join a Medicare plan. If I'm going to take the plunge, I need to know more, a lot more about my choices.
Absolutely. There are a bunch of great choices of Medicare plans from Security Health Plan. You just have to call the sales associates and they'll help you find the plan that's right for you.
Really?
Yes. My friend said she called them, they were very patient, and she trusted them to find the plan that was right for her.
The Medicare Advantage plan you can enroll in is our Secure Saver Medicare Medical Savings Account, or MSA plan, which is available statewide. We'll go over the MSA plan next.
You know, Ellie, I'm enrolled in a health savings account, an HSA, and it really helps us save up the money we need for our health care. I wonder if there's something similar when you're on Medicare.
Actually, my friend was in the same situation with an HSA and said there is a similar Medicare plan that acts the same. It's actually an MSA, which is short for Medical Savings Account.
Here's how our Secure Saver MSA plan works.
Begin by enrolling in an MSA plan through Security. We'll work with a company called Optum Bank, member FDIC, to set up your MSA. Then you'll receive a welcome kit and a debit card for use on qualified medical expenses. Each year, Medicare through Security Health Plan deposits a fixed amount into your Optum Bank MSA.
When you visit your healthcare provider, you can pay from your own funds or use funds from your MSA to pay for those services. Once you've met your deductible, Security Health Plan will cover your costs until the end of the year.
In 2022, the Secure Saver MSA plan deductible will be $5,600. Medicare provides an initial deposit of $1,920, meaning the difference of $3,680 is your total out-of-pocket expense for the year.
Any money from your MSA that goes unspent rolls over to the next year, and you can use your Secure Saver funds for any qualified medical expense.
You get all this for a $0 monthly premium and no monthly maintenance costs. There are a few caveats. 1, you must continue to pay your Medicare Part B premium. 2, while you may use your MSA funds for non-Medicare costs, things like prescriptions, dental care, dentures, eye exams, hearing aids, cosmetic surgery, and more, only Medicare-covered expenses will count toward your deductible. 3, Secure Saver MSA does not cover prescription drugs.
If you join a Medicare MSA plan, you can also join any separate Medicare prescription drug plan. You can have a standalone Part D prescription drug plan or a plan such as Wisconsin Senior Care to help you pay for your prescriptions.
Finally, if you must disenroll for some reason, like moving away from Wisconsin, you will need to pay a prorated portion of the Medicare deposit back to the plan. And that's our Secure Saver MSA.
Let's talk about one more plan option that may be familiar to you, a Medicare Supplement.
You said your friend has a Medicare Advantage plan from Security Health. But I've got a friend who's got a Medicare Supplement. And he says for him, it's the way to go. I think his plan is from Security Health Plan too.
It probably is. My friend said Security offers a Medicare Supplement. He said that's what made his choice so hard, because all the options in Security are good. I've heard a supplement protects you from medical costs not covered by Medicare, just like Medicare Advantage plans.
With a supplement plan, you can see any Medicare certified provider in the United States that has not opted out of Medicare. You can also add riders to give yourself even more coverage. Let's dig deeper. These optional riders allow you to choose your premiums and out-of-pocket levels to fit your personal and financial needs. First up is the Part A deductible rider.
This rider protects you from Medicare's hospital deductible, which is currently $1,484 each benefit period. What's a benefit period? Here's an example. After you leave the hospital and have not received skilled nursing care for 60 straight days, that marks the beginning of a new benefit period. As you can see, it's possible you could have several of these benefit periods in a single year. Next, the Part B excess charges rider. This rider is valuable if you use a provider that does not accept Medicare assignment. We will pay the difference between what Medicare pays and what your provider charges. The additional home health care rider. This rider guarantees you will be covered for home health care for an aggregate of 365 visits per policy year as required by Wisconsin law. It adds some coverage for home health care that is not covered by Medicare. However, because Medicare pays for the majority of home health care services, this rider may not substantially broaden coverage. Then there's the foreign travel emergency rider. After you pay a $250 deductible, we will pay 80% for emergency medical care received outside of the U.S. Care must occur during the first 60 days of the trip, and there is a lifetime limit of $50,000. Finally, there's the Medicare Part B copayment or coinsurance rider. This rider is a little different. With all the other riders, you pay an additional premium to avoid charges. This rider is sort of the reverse of that. With it, you can reduce your premium by agreeing to pay some charges that your supplement policy would otherwise cover. Things like a $20 copayment for office visits or a $50 copayment for emergency room visits.
Why purchase a Medicare supplement?
1. Our $30 per quarter benefit for over-the-counter health products was extended this year for our Medicare Supplement members. 2. Unlike with an HMO, there's no provider network. See any Medicare certified provider in the U.S. that has not opted out of Medicare. 3. Competitive premiums. Plus, there's no application fee to apply for coverage. Medicare supplement premiums increase as you age, however, so we encourage you to shop your Medicare options every year. 4. Guaranteed availability. Our Medicare supplement is available to all Medicare-eligible Wisconsin residents, and once you have it, you cannot be canceled or charged more than anyone else your age because you develop costly health problems. 5. Unlimited preventive care. Medicare mandates free access to most preventive health care. Security Health Plan takes that a step further by paying 100% for most annual physicals, preventive tests, and services that are not covered by Medicare. And we don't put a cap on this benefit. Other plans commonly limit this benefit to $250 per year. Again, our purpose is to keep you healthy.
Those are all the Medicare plan options offered by Security Health Plan. I hope we've shown you today that we put our members first. We do that because we really do care. We're not some national company with a headquarters halfway around the country and call centers halfway around the world. We're local. We're right here in Wisconsin.
Your calls will go to our friendly, award-winning customer service professionals and benefit specialists right here in Wisconsin who will answer your questions and get you the help you need. When you call with questions, you'll speak to a real person in Wisconsin. Most of our employees are from here. This is our home. You are our neighbors, our friends, our family. doing right by you is what we're all about.
Wow, Jim, you sure know a lot about Medicare. I'm glad I came over today. Thanks.
No problem, Mike. I'm going to give Security Health Plan a call. My friend says after you join Security, all you have to do is call their Medicare customer service team whenever you have a question about your coverage. Now, let's take this baby for a spin. The girls are still walking. We have plenty of time.
To sign up for Medicare coverage with Security Health Plan, simply call the number below or visit the website for more information.
Security Health Plan's Medicare plans are available only to Wisconsin residents. While we offer Medicare Advantage HMO point-of-service plans in many Wisconsin counties, our Medicare MSA and Medicare Supplement plans are available everywhere in the state. Please call our sales department at 1-877-909-1045 to find out exactly which plans are available in your county and to learn more. Thank you.